Hi, my name is Ana Cristina Wong and I want to talk about congenital adrenal hyperplasia. First, what's congenital adrenal hyperplasia? It's a group of autosomal recessive disorders, each of which involve a deficiency of an enzyme involved in the synthesis of cortisol, aldosterone, or both. Deficiency of 21-hydroxylase resulting from mutations or deletions of CYP21A is the most common form of CAH, accounting for more than 90% of the cases.
Hello. In this health sketch, we want to talk to you about CAH, which stands for congenital adrenal hyperplasia. Congenital means it's present from birth. Adrenal refers to the part of the body affected, and hyperplasia describes the change that happens. CAH is a condition about hormones. You may have heard of the word hormone before, as there are lots of different types in the body. In fact, a hormone is just a chemical messenger, sending a message from one part of the body to another. So both these types of hormones are important, and having the right levels in the body is also important, particularly for corticosteroids. The brain tries to control how much corticosteroids the adrenal gland makes grow in size, which is what hyperplasia means. But because of that faulty gene, the gland still can't make the corticosteroids. With the adrenals working harder but still unable to make the corticosteroids, more of the sex hormones are made instead. So, the symptoms of CAH are the result of having too little of the corticosteroids and too much of the sex hormones. But there are different types of CAH, depending on the gene affected, and the severity of CAH varies a lot. In severe history of CAH, genetic testing is available to find out if you are a carrier of a faulty CAH gene. This may be important for parents thinking about having children, and genetic counseling can be helpful. Babies can even be tested before birth while in the womb. Particularly need adjustment that affects the way hormones are made in the adrenal gland. We've talked about how the condition occurs, the symptoms that result, and how it can be treated. We hope that Health Sketch has been helpful to you and those around you. Health Sketch. Health for all to see.
Now, on the symptoms, it depends on the nature and severity of the enzyme deficiency. Although the presentation varies according to chromosomal sex, the sex of a neonate with CAH is often initially unclear because of genital ambiguity. In females with CAH may present precocious pubic hair, clitoromegaly, or both, often accompanied with accelerated growth of and skeleton maturation.
Adrenal hyperplasia is a mild or late onset form of CAH. We most often encounter this in true of young girls who may begin to show underarm hair or pubic hair before the usual time of onset of these signs and symptoms. In the adolescent population, teenagers.
In other findings, patients may present with dehydration, hypothermia, and hyperkalemia, especially with the stress or illness. Males or females with 1-hydroxylase deficiency may present a salt loss crisis. Later in life, these patients develop hypertension, hypokalemic alkalosis, or both. Even starts deficiency lipodadrenal hyperplasia usually have signs of adrenal insufficiency, egg poor feeding, vomiting, dehydration, or hypotension. Hyperpigmentation occurs in patients with deficiency of enzymes activity involving cortisol synthesis. In conclusion, treatment of CAH varies greatly depending on the type and severity, and it cannot be cured, but it can be effectively treated. Treatment of classical CAH starts soon after birth and it's needed throughout the patient's life. Here's a case of a girl.
So this video is going to be about congenital adrenal hyperplasia. And first off, testosterone, which can cause a deeper voice and sometimes facial hair and just a bunch of, symptoms and whatnot. But my problem was I was going through puberty at the age of 7 when it should be around the age of 12. So we were able to hold off getting my... and just a bunch of stuff like that, and it's not comfortable at all. And enjoy my beautiful picture here. So you have to consume the medications again without vomiting them up and, just get my spunk back and whatnot. And whenever I go on and
Thanks.
produce cortisol.